My name is Yoo Khee Chai. I'm from Malaysia. I'm 66 years old. My type is lymphoma. Lymphoma here, and then my neck here, and then here also.
First, it was just a small little tiny, the $1 size. It was in September. Then as it grew larger and larger, before Christmas, it was so large, it's just like the balloon is going to burst like that.
October, the children start making noise. They say, "Daddy, you better go and check." I was hesitating because it's not painful. It's just a lump. So somewhere I waited until November. I thought it is due to my tooth. So I went to the dentist. So the dentist checked. He said, "Never seen this before." So refer me to another division, the ENT, ear, nose and throat. The ENT said, "This is not an ENT problem." Then they took a biopsy. The biopsy, they take a little bit, go for medical lab test. After the lab test result come out, they noted there is a low-grade B-cell lymphoma. Then the doctor referred me to another department. So the oncology doctor after asked me to go for another CT scan. So from the CT scan report, they found out that it's already spread to my body. The doctor said she want to give me a 6 dose of very strong chemotherapy. Then I got a shock. Then I called up my friend in KL. So my friend said, "You know someone who has some remedy lah." I bought some of the product. I tried for I think a few weeks. At the same time, they asked me not to eat any meat, no egg, only vegetables. My weight slowly coming down. At the same time, I checked my face. The tumor doesn't seem to be slowing. So I looked for another alternative. I looked around and then I found another doctor in my hometown. So he recommended me the intravenous vitamin C and also the hyperbaric oxygen therapy. It is like slowing down, but it is not going down. So my weight keep on going down from 62 drop to I think 55 like that. So I think also not right. It is not helping. At the same time, my sister also found your Guangzhou hospital. She was searching the Google information, Facebook. I see some success stories, people talking how good it is and everything. So many type of therapy. So I find very impressive. I don't see in any other hospital in Malaysia yet. Then after that, I attended the Dr. Lin talk in Butterworth. Then I met her. She said, this condition, I should come for treatment here faster, to heal faster. At the time when I came here, my tumor already enlarged. It's pushing against my ears. I can feel my hearing getting less and less because the tumor is getting very big. And then it's pushing against my skin also. My skin also very like balloon already. Both of them are quite good. Then they explain well. I asked them some questions. They can explain very well. The treatment recommended here is, they call it intravenous injection of the chemo drug. It is less damaging to my body. It shoots the chemo drug onto the cancer cell here, I think the back also. You just feel a little bit warm. It's not painful. It's about half an hour to 1 hour. After 24 hours, the bandage, I can sit up, I can walk already. So that is very good. I don't feel vomiting, I don't feel diarrhea or whatever. So luckily I come here. I think after the first treatment, after the chemo, I can feel the thing soften very fast. I think it shrink by more than 50%. My face now back to normal. After nearly 1 month, when I go back, I show them the picture. Everybody very surprised. They say, "Wow, your tumor shrink so fast." All say very good.
So I never thought that it shrinks so fast. So I was very, very happy. In fact, I have not heard of this intravenous until I went for the talk by Dr. Lin.
After my first treatment, I went back to Malaysia. I went back to my hospital to check my white blood cell. My white blood cell dropped to 0.9, very low. It is supposed to be around 4 or 5. And then the doctor immediately warded me in the hospital to give me injection for the white blood cell. I was warded there for 2 nights. I was warded in a room together with a few cancer patients, and I saw them all with the chemo pot. They did the conventional chemotherapy. Their condition is very sick. One of them, I think, cannot walk. I see their condition. I don't think they're going to recover so soon. After 3 days, I was discharged. So I compare with the conventional chemo. I think not so helpful, and a lot of side effects. If you do the invasive one, the what you call the intravenous, you don't be so worried because you don't have so many side effects. That is a good part because you don't kill all your body cells. I think quite good. Can feel my sweat a little bit. My last trip here, went to the river cruise. Quite good. At least you go out together, you can meet some other friends.
Oh, I'm so happy. Very, very happy. In fact, when we went back after the first treatment, we did introduce and tell a lot to the neighbors, friends and relatives about it. So in fact, we are trying to spread more about the goodness, the greatness here. The doctor, the services, everything here is fantastic.
I think modern hospital also, I think very, very rare. For those cancer patients, better quickly come here, then you cure faster. I met a lot of patients here. They have tried chemotherapy everywhere, cannot recover. They found out about Guangzhou hospital. They quickly come here. Now, one by one, they are recovering.